Hi everyone, can you see my screen?
Yep.
Perfect. All right. How's your day? Good.
Good.
Good, good.
All right. So, as part of Certificate to Public Safety, we are going to be discussing, mostly it will be a discussion session on basic life support or CPR. And I hope this is a very common topic and everyone is very well acquainted with what is CPR. Has anyone given a CPR before? No.
No,
No,
No.
I've done the course, but
Good.
I've never had to use it. So
Yeah.
yeah. Even in my work, there is a requirement. I have to do it, but I
Yes.
never did it in like
Yeah.
like real scenario. But I learn every year.
Yeah. Yeah. So as part of work requirement, most of us will have to complete this.
Yeah.
Kirsten, do you have to do this as well in the for the child? When,
yeah, I have to do every 12 months.
okay.
Yeah,
Okay. Yeah. Yeah.
that's me.
Sure. Yeah, all right. So just some online classroom rules which we are all acquainted with. I'll just skip this one as we already know. Um, so the objectives of today's session will be to understand the meaning of basic life support. So I'll be intermittently changing the words like basic life support or CPR, but they both are same. CPR is a very common term that we use for basic life support, and basic life support or BLS is mostly used in a medical field. And then we will be discussing about the chain of survival. And then by the end of the session, you will be knowing the steps of basic life support, and at the end, you will be able to perform basic life support. I'll be planning a demonstration session in our coming sessions as part of our unit of competency, but today we will be just dealing with the theoretical aspect. All right, so what is basic life support? It is a procedure used to achieve preliminary preservation or restoration of life until advanced life support can be performed. So basically, it's establishing and maintaining the airway, breathing, circulation, and other related emergency care during a CPR, in addition to AED, which is an automated external defibrillator. Early effective BLS is associated with increased chance of survival. So, as early as possible, if we give a person BLS, the chance of survival it is directly proportional. The survival rate increases. Um, so, who can perform BLS? What do you think? Who can perform BLS?
Anyone.
Anyone?
Anyone, yes, that's right. Anyone can perform BLS. It's better than no one performing the BLS. So it can be performed by anybody, even people who aren't medical professionals. The Australian Resuscitation Council holds the belief that any attempt at resuscitation is better than no attempt. So whatever information I'm presenting to you today is being taken from the Australian Resuscitation Council and the New Zealand Resuscitation Board. And those are the main two clinical bodies that we refer to in case of these emergency situations. Um, Now, what is a chain of survival? Any idea?
It's how you respond in the situation. So pretty much delegating roles,
Yeah,
key roles for every
yeah,
person that's around you or within that moment
yeah,
to ensure that the person needing CPR and
yeah.
basic life support gets the best chance.
Absolutely. So, chain of survival, as the term indicates, it's the series of crucial or significant actions that the rescuer takes to prevent any consequences like sudden cardiac arrest or to prevent further deterioration in patient. So, why this is important? These actions are vital for successful resuscitation and, when performed quickly enough, can significantly increase the likelihood of survival. So, basically, we are trying to prevent further damage to the patient or the casualty and increase the likelihood of survival. Am I going too fast? No.
No.
This topic is very common and we go through this every year. So, yeah. So that's the chain of survival, this picture. So you can see early recognition and call for help. Immediately call for help to prevent the cardiac arrest. Um, Early CPR, so to buy us time to keep the body perfusing with the oxygenated blood. Then early defibrillation, just in case the heart stops. It's basically trying to restart the heart. And post resuscitation care, that is basically asking for help and getting the casualty as soon as into a healthcare facility for uh, further care and management. So that's the chain of survival. If this chain of survival is followed in this manner, the survival rate is going very high.
So how do
Um,
you, can I just ask a question?
yeah.
How do you know, like, if you're somewhere and someone's just fainted and passed out, as opposed to whether or not they need CPR? Like, I think I'd freak because I'd be like, oh
Yes.
my God, I don't know what to
Yes.
do.
Anyone who is not a medical professional might freak because I'm just going in my next slides, we will be discussing about how do we know
Mm,
this patient needs CPR. So that is
yeah.
our next slide here. Uh, what is DRS ABCD or Doctor's ABCD? Have you heard of this?
Yep.
Yes. So D is for danger, R is for response, S is for send for help, A is for airway, B is for breathing, C is CPR, and D is defib. So this is the systematic approach that we take in life-threatening conditions to manage them in a timely manner. Now, I'll be answering to your question after the next slide, Rebecca, how to identify when to do the CPR for the patient or the casualty. So, the first one is look for danger. So, what are we looking for? We are just going to take a fictional character here. The patient has fallen down or the casualty has fallen down in a supermarket. So, what do you look for danger there?
Any spilling of any products, like, is there water on the ground close to
Right.
like electronics, or the sharp shelving, trolleys, other
Exactly.
people?
Yeah.
People, yeah.
Yeah. Like confined spaces because supermarkets can be having unstable structures, confined spaces, or anything sharp, chemicals, or water, as Kirsten said. So these are all the dangers. So you're looking for danger, make sure you've cleared the danger out of your scene, and then you're looking for the response. So here is the answer, Rebecca. So how do you
Cows.
Yes, we go for the cows. So, to assess the response of the patient, we go with the cows. So, can you hear me? You hold the patient and you literally shout in their ears, can you hear me? Open your eyes. What is your name? Squeeze my hands. So, these are the four questions you ask the casualty. If they don't respond to any of these things, you go to the next step.
I've never seen this before. That's
Oh,
so cool.
yes. So cows is the most easiest way
Yeah.
to find out if a patient is responsive, conscious, or unconscious. Yeah.
And it's a really good way to remember it
Yes,
too.
it is. It is.
Yeah.
And I think you might remember these four cows next time.
It's a really cool slide.
Yeah. And then you immediately what you do is you see the patient is the casualty is unconscious. Sorry, patient is a word coming to my mouth always because that's my field. I should change it with casualty. So you immediately send for help. So in Australia, we have the number 000. That's the emergency number we ring to get the help. Now, depending upon where you are, if you're in a hospital or in different institute, like the hospitals have a different setting to call the emergency. But if you are in public places, you call 000. So if
We normally, in our setting, when we get to this stage, sending for help, whoever's already done the first couple of letters,
yes,
they remain with with the casualty, and
yes.
we get someone else to send for help.
That's right. That's how we do it. So the first responder, the first person who is in the scene remains with the patient, and we ask the bystander or anyone around us to call for help, and they do 000. If you can't find anyone, you just shout for help. That's what you do.
Yeah.
Yeah. And then the next one after DRS is A, that's open airway. So managing the casualties airway must take priority over any other injury they have, including a spinal injury. So airway is the most important part of the CPR. So, if an unconscious person is lying on their back, what happens is their tongue might fall against the back of the throat and obstruct the airflow. So, we have to maintain an open airway to make sure that we are not obstructing the airflow. So, how do we do that? So we do the head tilt, chin lift. So as you can see in the picture, one hand goes on the forehead of the casualty, and the other hand fingers, especially the thumb and the forefingers, you try to lift the chin of the patient in order to look the airway. So why you do this is you're trying to open the airway and also inspect there are no foreign bodies in the mouth. So, is that clear? Head tilt and chin lift?
Yeah.
Yeah.
We have to also check to make sure that there's like no toys or anything, or like small
Yes.
parts in the mouth. So then we have to then obviously put them on in the recovery position and
Yes.
do like a scoop.
Scoop. Yeah.
Yeah.
That's right.
We don't
That's
ever
right.
like poke it in, but obviously we
Yeah.
have to have PPE on and all of
Yeah.
that before we
Yeah.
put.
If you're not confident in taking that foreign body out, don't do it. Otherwise, you're risking the casualty again by pushing it more further in. So, if you're confident that you can take it out, just go for it.
Mm.
Yeah. And then what do you do for the B? B is the breathing. So you look, listen, and feel. So when assessing the patient, resident, or casualty's breathing, look for upper abdomen or chest movement. So you're looking for the rise and fall of the chest. You listen for the air escaping from the nose and the mouth, and you feel for the air movement at the nose and the mouth. At this point, you should be able to ascertain if the patient is conscious, unconscious, breathing, not breathing, or abnormal breathing. You will be able to find out by this step. So you look, listen, and feel. Now comes the compressions. So there are many research articles on whether compressions should go first or rescue breaths should go first. As per the ARC guidelines and ANSCOR, they say compressions and then rescue breaths. But there are incidents when the rescuer are not comfortable for mouth to mouth breathing. What do you think is the what can we do in such situation? If you are the rescuer, what do you do?
You can ask someone else to provide the rescue breaths while you're providing the compressions,
You're
Yeah.
not
or
necessary.
you
You
just
don't do it.
provide the
Just
compressions and nothing
compression.
else.
That's
Yeah.
it. Yeah.
Yes, that's it. So if you are not comfortable, if there is no mask, nothing, no barrier device available, just don't do it. You can just continue with compressions. Compressions are as effective as rescue breaths. So if you continue with compressions, that will be fine until the help arrives or a second rescuer can take over. So, chest compressions should be performed at a rate of 100 to 120, regardless of age. So, that is basically 30 compressions and two rescue breaths. So, you do the compressions and then give two rescue breaths, then again the compression and rescue breaths. So, now if you are not comfortable in doing the rescue breaths, that's fine. Just keep doing the compressions. If you get tired, if you have someone around you, you can ask that second person to help you out with the compressions. So, sorry. To perform a compression, place the heel of one hand in the center of the patient or resident or casualty's lower sternum and the other hand on top of the first hand. Push down firmly, depressing the sternum about one third of the depth of the chest, which is usually more than 5 centimeter. Compressing too high may achieve inadequate depth. So always the depth quality is very important when you do the compressions. So usually they say more than 5 centimeter of compression. The depth of the compression is a quality compression. So that's how you hold your hand. That's the position of your hand. If possible, rotate rescuers every 2 minutes to prevent fatigue and consequently poor compression quality. Minimize interruptions to compressions. Do not pause compressions to check for breathing or responsiveness. CPR should only be interrupted for AED defibrillation, so only to apply the pads or just to to shock the patient. That's when you stop the compression. Otherwise, you try to keep going with the compressions. Rescuers who are appropriately trained and willing to give rescue breaths should do so. Two rescue breaths should be performed after every 30 compressions. So it's on the rescuer if you want to do the rescue breaths or not. Then D is attach the defibrillator. So have you guys seen a defibrillator? Yep. At workplaces for sure, but
Yep.
also in supermarkets, you will
Yep.
find it at sports, like sporting facilities, aquatic centers, workplaces, everywhere. You will have an AED. And I think at workplaces during the induction training, we all are oriented to where these AEDs are kept. And also, if you go on Ambulance Victoria Registry, AED Registry website, you will find all the AEDs that are registered within Victoria, and they will give you the information where when these AEDs were registered, they are functional, and where they are located. So it's easy to find in case if you are in a very unknown or unfamiliar place and you need a AED, if you go to this website, it will give you the information. So Ambulance Victoria AED registry gives you information about that. Um, so what does the defibrillator do? Does anyone has any idea?
It establishes the heart to reestablish the rhythm.
Rhythm, that's the right word. So it reestablishes the heart rhythm. So what the AED does is it is quite intelligent. When you apply the pads, it detects if your heart is having an abnormal rhythm, and if it can be shocked, to get it back to a normal rhythm. So it will give you all the prompts. You don't have to do anything, just apply the pads and wait for the prompts. Just follow all the instructions given by the AED. So if the AED tells you to shock, you shock, otherwise you just leave it. So they are devices used to deliver controlled electrical shocks to people experiencing particular cardiac arrhythmias. So arrhythmia means it's abnormal rhythm. AEDs are small and portable. They are really small, like they're just easy to carry along. They can be found in many public places, including supermarkets, workplaces, and sporting facilities. It is your responsibility to know the location of AEDs in your workplace. So, as part of induction, I think training, we all will be told like where the AEDs are kept in the organization. AEDs must only be used alongside CPR. So we should be doing CPR alongside AED, otherwise they won't be effective or the survival rate is very less. All right. So now when we are using the AED, there are a few things that we need to be looking at or we should be taking precautions. So because it's an electrical shock that we are delivering, we have to make sure the patient does not have any jewelry and no metals on. Ensure casualty is still not moving around. Don't place pads over implanted devices or medication patches. So some or patients or elderly patients, they might have a pacemaker. So make sure you move your pad. Just don't put the pads, the defib pads on top of the patch on the pacemaker. Just make sure you move it around and make sure there is no oxygen, water, or you're not touching the patient's surroundings when you are charging the defib. So this is very important, otherwise you may get injured as well. So defib pad placement. Um, so you can see in the picture that the first pad goes on just right below right collarbone, and the second one goes lower left chest. Sometime what
Where the
happens
seatbelt sits.
exactly, that's the right way to remember. That's the right way to remember. So sometimes what happens is you see the patient's chest can be very hairy. So in, in hospitals they usually shave because on the emergency card there will be clippers and shavers, so we shave it. But in an emergency situation like in a supermarket and like a sporting facility, that's not possible. But just make sure.
Underwires on the bras.
Yes, exactly. So everything needs to be taken off, bare chest, and sometime with females, what I had to do a defib very recently, and the lady was a big lady, and her breasts were quite huge, so it was really difficult to put the pad on. So we have to make sure when we put the pad on, there are no air pockets. So you have to really like press it down the skin. So that's one important thing with the pad placement. Remember that AED must only be used for unresponsive casualty who are breathing abnormally. So anyone who is conscious, we don't use the defib. Okay, so what happens now if the defibrillation is successful and the casualty has a return of spontaneous circulation, is breathing fine, become responsive, start to breathe independently? So what you should do, you should stop the CPR, leave the AED pads in place just in case if the patient goes back into arrest, we might have to use it again. Closely monitor, place the casualty in the left lateral position, that is the recovery position, and wait for help to arrive. Most of the time, by this time, the help will be there. They're pretty quick, they will be there. So, when we say about the recovery position, so this is the recovery position. So this position helps to mainly keep the airway clear. So you can see the knees are flexed towards the abdomen. It will stop the body from rolling onto the stomach, and the hand supports the head. So this position is really helpful in case when there is patient is vomiting. So soon after they regain consciousness, there are chances that they vomit, or there are secretions in their mouth. With this position, it just comes out of the it just drools through the side, and this will help us to have a closer monitoring as well. So, if the defibrillation is unsuccessful, continue CPR for a further 2 minutes and follow the AED prompts. Only stop if you are alone and it is impossible to continue. It's hard work. Doing compressions is really hard work. Like if you do it for 2 to 3 minutes, by that time you're done. So if you are alone and it is impossible to continue, you stop the CPR. CPR is ordered to be stopped at the discretion of a healthcare professional. So if someone says no, the patient is passed away and there is no point of doing the resuscitation, you stop the CPR. So these are the two main situations where you don't continue the CPR. So before this slide, let me just try to show you a video. Just mm,
show you what to do
can you
if you
hear
see
that?
someone suddenly collapse and they don't seem to be responsive. First step, we're going to ensure that there is no danger. Then we're going to check for response from the person. We're going to ask them a few questions and we might actually even pinch their shoulders to see if they'll respond. Hello, can you hear me? What's your name? Squeeze my hands. This person is not responsive. So the next step is to send for help. The number in Australia to call emergency services is 000. At this stage, I would also encourage, as soon as bystander support arrives, for them to locate the nearest defibrillator and get that over to us as soon as possible. Next,
Can't see the video, Anu.
the person's airway. We go.
Sorry, you can't see the video?
No.
Oh,
I've got chain of survival on the screen.
really? Let me just try it again.
Going to tilt their head back. Open up their they don't seem to be responsive.
Can you hear that? See
First
that?
step, we're going to ensure that there is no danger. Then we're going to check for response from the person. We're going to ask them a few questions and we might actually even pinch their shoulders to see if they'll respond. Hello, can you hear me? What's your name? Squeeze my hands. This person is not responsive. So the next step is to send for help. The number in Australia to call emergency services is 000. At this stage, I would also encourage, as soon as bystander support arrives, for them to locate the nearest defibrillator and get that over to us as soon as possible. Next, we're going to check the person's airway. We're going to tilt their head back, open up their airway, and check if there's anything obstructing. No obstructions. We're going to check if this person is breathing. So we're going to look over the person's chest, and what we're looking for is that normal, gentle rise that our chest does when we're breathing. We're going to listen for any sign of normal breathing, and we can also feel that chest for any sign of breathing. The person is not responsive and they are not breathing, or they're not breathing normally. So we need to start CPR. To locate where we're going to place our hands on the person's chest, we can go to their underarms with our pointer fingers coming to the center of their chest, and then with the heel of our palm, we're going to place the hand down, keeping our arm straight, interlocking our other arm, leaning over the person's chest, and we are going to push. Now we're actually going to push hard and fast. We're going to push about a third of that person's depth of their chest, and we're going to also allow for that chest to rise back to its normal position. Now we're pushing at a beat of about 100 to 120 compressions a minute. If we're willing and able, we can do rescue breaths. So to do a rescue breath, we're actually going to tilt the person's head back, pinch their nose, open up the airway, and I would put my mouth over the person's mouth, forming a seal, and I would offer 1 breath, 2 breaths, and then I would come back to my chest compressions. Now I'm getting a bit tired, so I'm going to get that bystander support, and I'm going to communicate really clearly for a smooth handover for minimal time off the chest. 1, 2, 3. And I'll take over again. So I've just demonstrated how to do CPR.
All right.
That's really interesting because whenever I've done CPR training, and if you wanted to hand over to somebody else,
Yeah.
I've always been taught to finish the compressions, and then during the when I have asked for help,
Yeah.
so I'm gonna tap out.
Yeah.
That person will then change the face mask, face shield, or whatever.
Yeah.
And then they would, once I'm done the compressions, they
Yeah.
would then do the 2 rescue breaths, and then they would start compressions. I've never experienced a training where you swap through compressions.
Compression. So it's the reason why they say to complete the 30 compressions is so that we have the proper count. We don't mess the counting in between. So in the video, they are actually, if they're getting tired, they can swap it, but there is an interruption there. So usually they recommend after the 30 compression, during that 2 rescue breath, if you swap, there is minimal interruption to the compressions.
Yeah.
So yes, that's right. We
Yeah,
can
that
do
was just
that.
very interesting.
Yeah. Yeah. Any questions?
Is there a certain age that you shouldn't do, say, even with a defibrillator? Like what sort of the age
There is,
group?
so it all, so if it is in a community, we don't know, like age is not a barrier to defibrillator. You
Okay.
can, yeah. But in a
Babies, you use finger, I think. For babies,
yeah,
Babies,
you
it's
use
2
finger.
did
fingers.
you say babies or
Yeah, babies, like
uh,
you use fingers.
Rebecca, did you ask
Babe,
babies or
Well, it was just, yeah, what sort of
anyone.
age,
yeah,
like
so
is
today
there an
we,
age
we
limit?
discussed only the adult,
Yeah,
the CPR for neonates, infant, and child, they are different.
right.
The compression rates are the same, but the way we do the compressions, the depth of compressions, they vary.
So would you use a defibrillator if you had like a 5-year-old child that,
Yes, we do.
There's
okay.
pediatric
It's
pads
it.
in a
Yeah,
defibrillator.
yeah,
Oh, is there?
yeah.
Oh,
They're
Yeah.
very tiny ones. We do
okay.
have that. Yeah, yeah,
Yep.
yeah.
The rescue breath for a baby is like
Oh,
that's
You
all the breath
don't
is.
give the full blown, you just give
yeah.
Like you're going
yeah.
for someone. And it's nose and mouth sometimes.
Nose and mouth sometime. Depends upon the size of the baby's face. So if it's a big face, we can't cover that. So yeah, it's totally different. It is going to be a separate session. Yeah. Yeah. So I'll be sending out a quiz just to assess the knowledge that we've gained through this session. But if you have any questions, please feel free to ask. Any feedback that you want to give.
That was so good. I still like the
Good.
cows thing. That was so good.
Yeah.
Yeah.
That was a great session. Thank you so much.
Yeah.
Thank you.
Yeah, you did well. I know.
Thank you. Thank you so
Very
much.
nice. Yeah.
I'll just stop the recording. And then, yeah.